Thank you, Deputy Presiding Officer. I'm pleased to take part in this debate, and it could be viewed as a debate on two separate topics, unless you agree with the one that the Conservatives are putting forward, that one policy directly influences the other. And I don't believe that. However, I think both those issues are very important, and I'm grateful for the opportunity to debate them. The Labour Party here in Scotland has long advocated that this government should make prescriptions free to cancer sufferers, and my colleagues have outlined this earlier today. As this is the case in both England and Wales, and we believe it should be a priority. It should happen now rather than be phased in, and it's unacceptable that due to this government's policy, cancer sufferers north of the border still have to pay for prescription charges.
I wonder what your message is to all of those organisations that have launched a campaign in England for them to follow the lead of the Scottish Government to abolish for all of the other chronic conditions. Will you not back them rather than trying to create artificial divisions?
Rhoda Grant.
Well, I'm not creating artificial divisions, and if the Minister would give me a moment to expand. What I'm saying is not about stopping her policy of free prescriptions for all. What I'm talking about is rebalancing her policy of free prescriptions for all, and facing this in a different way that would allow cancer patients to have free prescriptions now. That would mean that people like myself would have to wait a little longer, but I, for one, would be willing to do that in order that cancer patients could be prioritised. Cathy Jameson mentioned the well-known fact that cancer patients suffer economically due to lengthy periods of work and indeed the costs of their illness. Macmillan and CAB have looked into this, looking at fuel poverty, but there's an awful lot of other costs, and I think CAB also had a research report out a couple of years ago that made this point very strongly, and free prescriptions would alleviate some of that financial pressure from them at a very difficult time.
Thank the member for giving way, and certainly nobody would dispute the importance of ensuring that cancer patients receive proper treatment. But is the member really saying that people with other chronic conditions would be better served by a situation where they had to continue to pay for their prescriptions?
I don't think the member listened to a word I said, so I would suggest maybe free ear syringing for him. The motion moves on and talks about health visitors and talks about using the money from reducing prescription prices to increase health visitor numbers. In the Health Committee, as Christine Graham mentioned, we recently carried out the inquiry into child and adolescent mental health services. And it became obvious that health visitors had a crucial role to play in this, both by identifying children in their early years who were developing mental health issues, or identifying mothers who suffered postnatal depression. And therefore, I think most of us would agree that we need more health visitors. I believe that these resources need to be targeted towards families most in need. However, the current policy needs to be refocused to make sure that it's universal for longer. And families also need a minimum level of service throughout the early years. Currently, some families fall through the safety net because of where they live or because their family are not seen as being within a priority group. It's very obvious that a family needs a high level of intervention if they're living in deprivation or have a drug and alcohol problem. However, the universal service, which, as I said, lasts only 8 weeks, means that families who develop problems later than the 8-week stage have little or no support. One of our problems, however, is that the numbers of those training as health visitors have fallen. We had a high in 2001-2002, but it's been falling steadily ever since. So unless we actually increase the number of people in training, we won't be able to fill any additional posts that we create. And in places such as Highland, no health visitors are being trained, and that's due to the review of nursing in the community pilot, which seeks to assimilate the role of health visitors into the new community nurse role. And because fewer people will consider the career of health visiting due to the uncertainty hanging over their profession.
Jamie Stone.
I thank Rhoda Grant for giving way. Would she agree with me that there is fairly considerable disquiet amongst the medical and nursing profession about these changes that she has just outlined?
Yes, there certainly is, and I would ask the Minister if they would intervene and make sure that health boards who have stopped training reverse this retrograde step and make sure that the career of a health visitor is retained and recognised. And we have an age profile within the nursing profession and indeed within the health visiting profession to say that, which tells us that large numbers will retire in the same time in the very near future. And I've been raising this with the Minister with regard to newly trained midwives to ensure that we've got enough training places for work experience for them to fill this gap. But we need to do the same with health visitors. Coming back briefly to the review of nursing in the community pilots, and I'm quite puzzled about some of the issues in this. One, health visitors are included, but community midwives are not, and one would suggest that those roles are interlinked. And I would suggest, rather than creating a new community nurse role, we look at developing a team working together very closely, social workers, midwives, community nurses and health visitors. In rural areas this is more challenging, but we've heard before of GPs and nurses who are very highly skilled generalists working with this. So I would ask the Minister to look at how highly skilled generalists are rewarded and how their career progresses, because people who have similar levels of qualifications and are specialists have this recognised in their qualifications and therefore their pay. However, if you're a skilled generalist, that is not recognised as part of a qualification, and therefore you don't have the career progression or pay. So I'd ask the Minister to look at those issues and reflect on them and maybe look to finding a solution for rural areas.